Hello. We're going to go over chapter 19 it's over the anti-seizure drugs. And so we have key points that we need to address and look at um, over the overall chapter. You want to um, really focus on these, but also do your end of chapter questions. Anything um, for the NCLEX. Any questions related to this, do that, and then also your study guide. So seizure disorders result in abnormal electrical discharges from your cervical neurons and is characterized by the loss or disturbance of consciousness and usually is involuntary and is uncontrolled movements. And you have so many different types of seizures. It's just from basically pet mal, where it's basically the absent seizures. You only can tell with a well-trained eye. There might be nystagmus, just little twitching of the eye. They may get sleepy, where you don't even notice that they had a seizure, or then there's the full that ranges from the full grand mal seizure. It can be very complicated to totally diagnose. And in my field that I worked in, I dealt with a lot of seizure activity and saw a lot of different type of treatment for this. So we once you have a suspicion of seizure activity, you would want your child or individual to go to somewhere that really has a neurologist that is highly trained, because you will, when you're limited to an area that is maybe has one neurologist or maybe two neurologists in the whole city, and you're not going to see the competitive nature of trying to really, you're very blessed if you do see some aggressive treatment and to find the real solution to the issue. So with this, you want to have a electro or phelogram, which is an EEG, measures abnormal electrical discharges of the cerebral cortex. And you need that over a period of time. So you'll usually, especially with children, they will have you in the hospital over a period of time to measure that electrical activity. So because they want to see if it's actually related to just benign seizure disorder, or is it related to diagnosing epilepsy. You'll also most likely have a MRI performed. 75% of the seizure cases are considered primary or unknown, or idiopathic is another name for unknown, no etiology. And then the remainder of the secondary is secondary to brain trauma. They say it could be hydrocephaly sometimes, secondary to prenatal care or actual labor. There's brain anoxia, or maybe an infection could have happened, or cerebral vascular disorder. Now, epilepsy is a chronic, usually lifelong disorder. The majority of people with epilepsy had their first seizure before the age 20. Now, say for instance, if you had your bout, like you had a viral infection and it actually, say, viral meningitis, or you had a high fever when you're a child and you had a seizure. That's usually secondary to an etiology that is being. But when you have just basically spontaneous seizure activity with for no reason, that's when it gets complicated. The seizures that are not associated with epilepsy could, like I said, result in fever, hypoglycemic, like that could be an activity of one of the issues before you go into a coma state. When you are diabetic and you have a hypovolemic episode, you would actually have that action depending on the individual. It's very individualized. And electrolyte imbalance, metabolic imbalance, alcohol or drug use, you see that, especially in the drug use issue. When these conditions are corrected, you'll see the seizures actually cease. Now, there's syndromes they are finding when children are born, and that they have a chromosomal pattern that will associate with this. And there's not really a lot of things they can do with it. You hear a lot of the pharmacological promotions now, where the cannabis is helping. Well, it helps to a degree, but I've actually seen a parent that started it out, but the what we were talking about in the last chapter, when the patient or student, whatever, they get conditioned to, or they have a tolerance or something. You can only go up so high on some medications, and if it's helping initially and it's great, but then once they build up a tolerance, they start having an episodic seizure activity. So it's all individualized, and so they have different things like implants that they can actually put in the head. They have vagal stimulators, which is a magnetic a device where you swipe it, and it actually is connected to the vagal nerve that is does help in so many ways with so many children or people. So if you really get into it, you'll see how extensive this can be. But associated with the medications is seizures that are not associated with epilepsy and fever. Recurrent seizures can result from birth, prenatal injuries, head trauma, congenital malformations, neoplasm tumors, and then the idiopathic unknown cases. Now, there are various types, like I had said, which are tonic, which is clonic, basically formerly known as the grand mal. And then you have the absent seizure, which was formerly known as the pet mal, and then the psychomotor. Now, review the types of the seizure activity. You can see that on page 248. Actually, that's the different drug classes for it. Let me see. Now, you go ahead and look at yes, on table 19.1 on page 247. Look at that and view it, and then you will actually look on page 248 in the chart on 19.1. You'll see the different drug classes and dosages and the rationales because of the contraindications and the therapeutic effects, side effects, and then it goes on to the anti-seizure drugs, which will be on page 250, table 19.2. So there's a big number of medications, but they're what's called the preferred medications that you'll see most readily. They are, I do want you to know these medications and make drug cards for these because you'll see them again. We're going to be actually working on, and don't forget, um, you know, when we're in the clinical state, you're going to come across this issue. So, with that being said, the various types of seizures, the drugs used, you will have anticonvulsants or anti-epileptic drugs, AEDs, which anti-seizure drug stabilize the nerve cell membranes and suppress the abnormal electrical impulses in the cerebral cortex. And so these drugs prevent seizures, but they do not eliminate the cause or provide the cure. So you basically are going to be putting a Band-Aid on it in most cases, unless it is secondary to, like I said, associated issues. Say, for instance, if you have a tumor, if you have fever, if you have anything related to the cerebral spinal fluid, changes in pressure, diabetes, things like that you can prevent. But then when you have unknown etiology and there's not a cause, and it could have been either genetic or it happened from the birthing process, there's not going to be a solution. So therefore, you're just going to have to treat it. So you're actually, there's types of anticonvulsants used to treat the seizures, including the high dantones and long-acting barbiturates, the successamides, the benzodiazepines, the carbamazepine. There's the Valproate. So the anticonvulsant drugs work in three different ways. One, by suppressing the sodium influx. Two, by suppressing the calcium influx. And three, by increasing the action of the gamma aminobutyric acid, which is the GABA. You'll want to know that the most common is the tonic phase of the seizure, which is the grand mal is the most common, which they now call tonic, where the muscles contract strongly, anywhere from 3 to 5 seconds. Then the clonic phase with the jerking of the legs and arms that lasts around anywhere from 2 to 4 minutes, and you want to know that for the textbook. But I've dealt with patients that it lasts up to 20 minutes, and that's with the diastat, which is just a diazepam. So the you have the first anti-seizure drug used to treat seizure was phenytoin, and then the high danton. You want to know the clients will need to be taught that usually meds are taken for a lifetime. And you also want to know and remember the safety issue. You want to keep a patient safe. Get everything away from the patient. Anything that he may be injured by, you want to, if possible, lay him on the side. Long years ago, you always knew that, oh, put something in the mouth to make sure they don't occlude the airway. Now, secondary is your safety. You want to make sure they're on the side, and always make sure the airway is patent, but you don't stick your finger or your tongue depressor in there most readily. You usually don't do that. Phenytoin should be or should not be used during pregnancy because can have a teratogenic, which means a poisoning effect because it passes the blood-brain barrier effect on the fetus. Cause red or brown urine measured, which is harmless side effect. A drug dosage for that is, and other seizure drugs are age related. Now, the phenytoin has a narrow therapeutic range of 10 to 20 micrograms per milliliter. The drug dosage is according to the therapeutic plasma of the serum level. If range is low, you'll have to make sure it's therapeutic. Monitoring therapeutic serum drug range is utmost importance to ensure the effectiveness, because of toxicity may result from drug levels above the desired range. High diatones are highly protein bound. So, if you have someone with compromised kidney function, you may look at that. May deplete or other liver-bound medications. So, just the different the high dantons commonly cause gingival hyperplasia, or basically an overgrowth of the gums. You'll see that on some people that if you're working with special needs, most likely in the community base, if we're able to, I would like to see y'all be able to go out to the school and have opportunity to see this autistic individuals, and you'll see that. Encourage meticulous oral care and dental, because you're going to have recession. And now, phenobarbital is a long-acting barbiturate, and it's prescribed to treat tonic, clonic, and partial myoclonic seizures and status the epilepticus. Now, barbiturates reduce seizure activity and enhancing the activity of the GABA. The therapeutic serum range for phenobarbital is 20 to 40 micrograms per milliliter. So, succinimide is a drug group that is used to treat absent seizures. Succinimides act as decreasing the calcium influx through the T-type calcium channels. And the therapeutic serum range for that is 40 to 100 micrograms per milliliter. Now, benzodiazepines that have anti-seizure effect are basically Klonopin or clonazepam, clozapam, chlorazepate, dipotassium, lorazepam, and diazepam. Diazepam is administered by IV or rectally to treat the status of the seizure activity. But it's a short acting, so other anti-seizure medications should be given for the long term. Now, the carbamazepine is a amine stilbepine and is used to control tonic, clonic, and partial seizures. The therapeutic serum level is 4 to 12. The potentially toxic interaction can occur if you drink grapefruit juice and is taken with this specific medication. The drug concentrates must be carefully monitored. Now, just remember, it's a big thing. Just know in pharmacology, and just most drugs don't drink grapefruit juice. The valproic acid is prescribed for tonic and clonic, absent and mixed type seizures. The safety and efficacy of this drug has not been established for younger children younger than 2 years of age. And they also, you can see if you do different lab values, the valproic acid can actually increase the liver enzymes. The patient, if it has a history of liver disease, shouldn't be on that particular medicine, and it has to be monitored very closely. Now, the therapeutic serum range for a patient with seizures for valproic acid is the 50 to 100 micrograms per milliliter. Now, anti-seizure drug dosage usually start low and gradually build it up over a period of weeks until the serum drug level is therapeutic. Now, during pregnancy, seizure episodes increase at least 25% in women with epilepsy. Hypoxia that may occur during the seizures places a big significant risk for the pregnant mother and the fetus. So you want to, many of the anticonvulsant drugs have tetragenic properties that will increase the risk for fetal malformations. Now, phenytoin and the carbamazepine have been linked to fetal abnormalities and anomalies such as cardiac effects, cleft lip, cleft palate. It has been reported that valproic acid is known to cause major congenital malformation in infants. 4% to 8% of the pregnant women who take the drug. The highest incidence of the birth defects occurs with women that takes a combination of convalescent medications. Anticonvulsant drugs tend to act as inhibitors of vitamin K, contributing to hemorrhage in infants shortly after birth. So you always have to look at those platelets in the mother. You'll have to monitor that. So anticonvulsants also increase the loss of folate, which folate will cause the spina bifida and other spinal neuro defects. And you end up having too little or too much cerebral spinal fluid. So the pregnant individuals should take daily folate supplements, which you should do anytime. If anyone's planning a pregnancy, you should start taking prenatal vitamin with 1,000 micrograms or 1 milligram of folic acid. Seizures associated with fever usually occur between children's ages of 3 months to 5 years. Epilepsy develops in approximately 2.5% of the children who have had one or more febrile seizures. Status epilepticus is a continuous seizure state. It is considered a medical emergency. If a treatment is not begun immediately, death could result, and I have seen that. The choices of pharmacological agents are diazepam, administered via IV, or lorazepam, followed by IV administration of phenytoin. Now, and that's phenytoin. For continued seizures, basically medalazine, basically like lorazepam or Valium, anything, you'll always see that ZO or LAM at the end associated with that. And then the propofol and then the high-dose barbiturates are used. These drugs should be administered slowly to avoid respiratory depression and also ileus issues, because you're going to be slowing down that, not only the respiratory, but you're going to slow down the gut. You're going to slow down the digestive system. So you don't want to have someone that are on high dosage. You want them to make sure that they're also on a higher fiber diet. Different things you're going to have to look into when you're doing patient teaching. So with that being said, you just want to know your anti-seizure drugs. They usually are set in a class, and you will also see where people with epilepsy, they will more so with that group always make sure that their lab values are therapeutic. And so that is the conclusion of chapter 19. And so if you have any questions, let me know, email me, and I will try to help you. Thank you very much.